researchers found that men and women have been getting vastly different advice for heart disease, and they found that the advice women were getting could negatively impact their health.
Cardiovascular disease has traditionally been thought of as a man's disease.
Dr. Catherine Lindley says fighting heart disease is also a fight against gender stereotypes.
It's been a long recognized issue that both women and their clinicians tend to under-recognize women's risk for heart disease across the spectrum. It accounts for about 1 in 3 deaths in women. So really, we're all essentially at risk for cardiovascular disease.
She says women tend to develop heart disease later in life and more commonly have symptoms of fatigue and shortness of breath. Those are symptoms that men don't usually report. So over the years, this has contributed to heart disease in women being overlooked. And Dr. Lindley says even when women do present symptoms, they're less likely than men to be prescribed medication.
In general, we know that men tend to be treated more aggressively with cardiovascular medications, even when presenting with a heart attack.
Knowing this, researchers from Massachusetts General Hospital looked more deeply into gender disparities in heart disease treatment and prevention. Doctors found men were 20% more likely than women to be prescribed medications to lower cholesterol and manage their heart disease. Meanwhile, women were 27% more likely to be advised to lose weight and 38% more likely to receive recommendations to exercise to deal with their heart disease. Dr. Lindley says from her experience, she thinks both men and women should consider diet, exercise, and medication.
They both need to be treated as aggressively.
And getting more aggressive with women's heart disease starts with doctors and their patients ditching stereotypes and changing the conversation so that women are encouraged to attack this deadly disease head on and early on. Alexa Liaco, Scripps News, Denver.